And of course you see for health systems that they're in different stages of maturity. Traditionally, you see maybe more mature economies where it's all about a lot of hospitals, hospital beds, and that's where we go. And often that's perfect for an acute problem. So I break my leg, I go to the hospital, they fix me, and I can go home. Unfortunately, what we see is that more and more there will be problems about prevention, there will be problems around chronic diseases. And where can that be treated? It can be treated at home. So I think there is an advantage to be ahead, and that is that you potentially have a more mature level of access, potentially a higher level of quality when it comes to treatment and healthcare professionals in their education, the way they can apply their knowledge. But there's also a disadvantage, and that you are maybe not set up for treating the demand that is coming to the market. So I think it's very much a balanced picture, but whatever I just said, I think it applies to all countries, but they're just in different stages. With pleasure, and I always say, technology is not the issue. And I think that's also what Ms. Adel was describing, that the technology is there and it's just up to us to leverage it. Where I see the issues is often complex problems can be solved by people teaming up. You need to find the right partnership to make it happen. Now that can take a little bit of time, but no one can do it on their own, so that's for me key. The second is that we can all do something for a while. The previous session was about sustainability, CSR programs in the year of giving, and that's also very important. But you want to scale and you want to make lasting impact through sustainable models. And that's often where you have to find a business model that makes it all last. And now, I want, of course, to add on a positive note. You know, you referred to a program that we spoke about earlier, and this has to do with Millennium Goals, maternal mortality in Indonesia. So you may know that in Indonesia, in 2012, they did a study. More than 350 mothers died while delivering healthy babies on 100,000. So you can do the math, it's too much. And the government wants to bring it back to 104. So where we try to help with a number of partners, like the government, but also one of the tertiary hospitals, is equip midwives with starter kits. They visit pregnant women at home, they do their set of measurements, then they have an app. In the app, you put whatever they find, and so everyone has a mobile phone, as we know, everyone can navigate to an app. That information is through normal IT sent to a tertiary hospital, and that's where they do the triage. So what we found in the first cohort of 500 mothers, 60 were at high risk. Now, if you're at high risk and you're pregnant, you don't want to have the delivery done at home. So then you can triage and say, let's bring these 60 mothers and let's have them do delivery in a tertiary hospital so that you prevent maternal death. And at the same time, to make the link to your point on education, we say, okay, it's not enough if we just have this program. We want to make sure that we also educate the healthcare professionals so that they know what to do. Otherwise, we have fantastic technology, but no one knows how to operate it. So as part of that, we have also educated 3,500 people on one of the Indonesian islands so that it really becomes a sustainable effort. So I think this is just an example on how you can team up, how you can work with the government, and how you can make it sustainable. And I think this is an important, like you say, saving lives. But even if you are based in the UAE, it's very important that you have access to healthcare at every stage of your disease. Right? And we are traditionally saying, if I don't see a doctor, if I don't have a face-to-face meeting, I don't have access to healthcare. But technology can also enable you to have a totally different interaction with your healthcare professional. It can be in an app, it can be to telecommunication. And what's quite interesting, we are in the UAE, so I want to say something about the UAE. UAE came out as #1 when it comes to the perceived readiness for access to healthcare. And that's quite interesting, that the people, so in total 33,000 people were interviewed, but in the UAE the people were saying we are most ready for new types of access to healthcare. And I think that's where technology can have a huge impact. New technology is accepted by people. People are ready for it. I think short-term, partner up, develop models that are sustainable. And I think one of the things, we're talking about Asia, and what I love about this area, that we're always thinking about, we are ahead, how can we stay ahead? And I think what Mr. Adil said, leapfrog, and I think that is a huge opportunity here. If you go back to my home country, some politician needs to decide that we need to close 30 to 50% of the hospitals. Now, I can tell you that's a difficult decision, very hard for a politician. Here we have the opportunity to not think about restructuring, but creating. And I think that's the big opportunity here. So I say short term, let's get going, long term, create the future.